Good afternoon, everybody, and welcome to the Joint Task Force Briefing. I'm Doug McGowen with the City of Memphis, here representing the task force. And today we have several people with me, Dr. Nick Hysmith from Methodist Le Bonheur Healthcare and UTHSC, as well as Mayor Harris. And we'll all talk, and then we'll open it up for some questions. So we'll change it up a bit today. I'll be presenting the overall data as well as an update on vaccinations. Then I'll turn it over to Dr. Hysmith. As we have gone through the pandemic, we have seen, with the rise of the Delta variant, increased number of cases, also increased number of hospitalizations. Yesterday, we had 408 new cases. That number brings us to just under 300 as the average number of daily cases we're seeing in a 7-day period. Obviously, that is significantly higher than we have seen just a few weeks ago. Our positivity rate is now 14%, meaning 14 of every 100 tests that we run are positive for COVID-19. And the reproductive rate of the virus is 1.46. What that means in practice is that for every 2 people that come down with COVID, another 3 people will be infected with COVID. We need to get that number below 1 for us to be moving in the right direction. The variant, the COVID-19 Delta variant, is estimated in Shelby County to be making up now more than 90% of our new cases. Not all, but 90% of our new cases. And as we all know, that is much more transmissible than previous variants. Unfortunately, we have suffered 23 new deaths in the last 7 days here in Memphis and Shelby County. And I'll remind you that just 7 days ago, we had 12 deaths in a 7-day period, so almost double the rate of deaths. As of today, we have 279 people hospitalized with COVID-19, and we have 81 people in the ICU, about half of them on ventilators. You'll recall last week we had 162 people in the hospital, and the week before we had 115 people in the hospital. 115 people to 279 people, that's almost a 250% increase in just 2 weeks' time. For reference, at the peak of the pandemic, we had 600 people in the hospital, and we had 150 people in the ICU. So we're about halfway to the maximum capacity, and we're on about the same glide slope that we were when we got there before. Doesn't mean we're going to get there, but that's where we are for reference. On to the vaccine campaign, which is the real key to getting us out of this. We have administered more than 748,000 vaccines as of last night. We'll hit 750 today. We have 415,000 people in Shelby County who have received at least 1 dose, and we have 338,000 who are now fully vaccinated. We had spoken before about the possibility of closing down our mass vaccination site at Pipkin at the end of this month. We will not be doing that. We will keep that vaccination site open through at least the end of August in hopes that we can meet what we think will be a rising demand for vaccinations that are easy, convenient, and drive-through. That's in addition to the efforts that we're undertaking with our partners at local clinics and pharmacies, but also next week we will begin concierge level service for vaccinations. In other words, our street teams will be going to neighborhoods, passing out information, knocking on doors, and asking people if they would like a vaccination. And if individuals have not been vaccinated and say, I would like one, we will arrange for a vaccine to come to them within 2 hours' time. If it's not there on the spot, it will be there within 2 hours. We are going door to door, coming to your neighborhood to administer vaccines. Now, I can't do that for everyone, but I would ask that all of you come out if you'd like a vaccine to the Pipkin site, to the pharmacy of your choice, or any of the private providers that offer a vaccine at no cost to you. But we will be in the neighborhoods offering vaccines. There is still plenty of easy and free testing available to everyone. We have at our Lamar Avenue inspection station, that's what we used to call it, down off of Lamar Avenue, at RKS Commercial Cove. There's drive-through testing that's free, easy. You don't have to get out of your car. You can get tested. If you're worried at all about your status, I encourage you to get tested. Again, they are free and readily available. And for all the information about where you can get vaccinated where you can get a test. You can go to covid19.memphistn.gov, and you'll find information there about how you can get a vaccine or tested. Last thing I'll mention is that if you are constrained with your transportation, you can call 901-RIDE-901, and we will come to your house, pick you up, and take you to a vaccination site and then take you back home. So please take us up on that offer. So now I'm going to turn it over to Dr. Nick Hysmith, and he's going to give us some comments from the medical perspective. Dr. Hysmith.
All right, good afternoon, everyone. I'm going to repeat a little bit of the information that's already been given and then hope to shed a little bit of light on some of the things that we're seeing in the hospital setting and really on the ground. I think that as it's already been mentioned, we've seen a concerning rise in the number of positive cases over the last several weeks. We know that this is attributed to the Delta variant, which is highly contagious, as we have seen from many studies that have been put out. We also know that we are seeing the majority of severe illness and hospitalization in our individuals that remain unvaccinated. So I think that's a key group that really needs to hear this message, and we need to really focus our efforts on getting out to the unvaccinated individuals and hopefully increasing the rate amongst that group so we can decrease this trend that we're seeing. The other thing I would like to say is that we know that these vaccines are safe and effective. We know that they prevent severe illness from COVID-19. They prevent severe illness from the original strain, as well as the strains that we've seen up until now, and also the Delta variant. And that is very important as we're looking over the next several months as we enter the fall and winter season. I will make a couple of comments about children. We know that over the past 18 months since this pandemic began, that severe illness in the pediatric population has not really been has not been much severe illness in the pediatric population. That is great. That's not to say we don't see any severe illness in that population, but it has been relatively small. One point of concern that we have moving into the next several months is that the Delta variant may be different in that regard. We have seen across the South several children's hospitals that are reporting increase in their pediatric admissions due to acute COVID-19. This is something that we're going to look and monitor very closely over the next several months, as we know that a large group of our pediatric patients or individuals in our community, those that are 12 and under, are not yet available to receive the COVID vaccine. We hope that will change soon in the next coming months. I think that as we're looking at the ground level, from the hospital level, what we can say is that we are strained. We are strained as we see this increase over the last several weeks. What is different now than it was several months ago is we are seeing a lot of other illnesses and conditions that are requiring hospital admission. We're in the middle of the summer, so trauma and accidental injuries have increased, which puts a strain on our healthcare system. In the pediatric setting, we have RSV as well as some other viral illnesses that we are seeing at winter levels at this point due to the lack of interaction with children last winter. We're seeing that now since it's the summer and all the kids are sort of getting back together. If we put that on top of an increasing number of COVID-19 patients and an increasing level in the community, then that really puts an even greater strain on our hospital system. So I think that that's something we're going to have to monitor over the next several weeks to months as well. I will echo that the most effective and easiest way for us to end this pandemic is for everyone who has not been fully vaccinated to please take advantage of every opportunity to be vaccinated. That is the only way we're going to end this pandemic and move on to lessen this disruption that we've had in our lives over the last 18 months. And with that, I'll turn it over to the Mayor.
Good afternoon. I'm pleased to be here on behalf of Shelby County government and the Joint Task Force, and Bruce Randolph to be in his place today because he has a conflict. Just a couple of updates. One is that Dr. Taylor this week was approved by the County Commission to become the next director of the Shelby County Health Department. She is a lieutenant colonel in the Air National Guard and a pediatrician and someone who has roots in Memphis and Shelby County, having started her career teaching biology at Fairleigh High School and as a White Station grad. So we're pleased to be through that process. I gave notice to the state of where that process sits this week, and I believe that our state partners are enthusiastic about the pick and eager to work with her. And so she will start on Monday, August the 2nd. In addition, we know that the environment around COVID-19 is constantly changing. Just this week, we learned that there is a chance, though it is a small chance, that vaccinated individuals can transmit the virus to others. As a result, the CDC has recommended masks in indoor settings, even for vaccinated individuals when vax status is unknown or when individuals expect that they will be around others with a compromised immune system. The Shelby County Health Department, in order to align with the CDC, will update the next health directive here locally. The updates will reflect the CDC guidance and urge residents to wear masks in these types of settings. This next directive will align with the CDC recommendation, but there are no plans at this time to go back to COVID-19 restrictions or mandates, and that would include mask mandates. However, nothing is completely off the table, and in my conversations with the health department, they continue to look at the data and the latest science. This next directive will be issued on Wednesday, which I believe is August the 4th. So right now, we urge all residents and visitors to our community, whether vaccinated or not, to take responsibility and to mask up when they are in these types of settings. In addition to the updates to the directive, over the next few days in Shelby County government, we will identify our buildings that are both open to the public and where vaccination status is unknown, and we will require visitors and employees to those types of settings to wear masks. In addition, I'll add that right now we're urging our youth and young folks to take advantage of the vaccine. Here in Memphis and Shelby County, our numbers with respect to our seniors, those who are 65 and older, are pretty good. We have about 85% of that population that has already taken advantage of the vaccine, but the levels of vaccination among folks in the younger populations is much lower. And so we would encourage youth and young folks to do what mom and dad and the grands have done and to roll up their sleeves and take the shot. We would also encourage organizations to do what they can to encourage their constituencies and their employees to take the vaccine. So for example, in the last few days in Shelby County, we've rolled out a paid leave program for those who are seeking the vaccine, which will apply to most Shelby County employees. And so we would encourage others to take a look at programs like that to give their employees access to the vaccine through time off or other innovations that they hear about. So let me end by saying that I know this conversation this week about the return to masking feels like we are moving backwards, but the reality is that this virus is persistent, and we're going to have to stay as tenacious as the virus is, and we're going to have to keep at this until we can defeat COVID once and for all. Thanks very much, and I think we are in a position to take questions.
Brad Broders, Local 24.
Hi, good afternoon, everyone. Maybe this question is, first question's for Doug McGowen. I know you were talking about the street service starting next week and the Pipkin feature for August. I know I've talked to pastors about their eagerness to host pop-up clinics at churches and other places like that. What are the discussions and tentative plans for that moving forward next month? I have a follow-up.
Thanks for that, Brad. And I should have mentioned that work does continue. We have lots of partners who've requested that. We have pastors who've come forward to offer their services. We have a program for that, and we are responding to those. So those pop-ups, as we've called them in the past, or those community-based events, will continue during the month of August. And that will complement what we're doing at the Pipkin, what our hospital systems, pharmacies, and local clinics are doing, and that we're also doing with our street teams. And did you have a follow-up for me or for another speaker?
Maybe for Dr. Hysmith. Thanks, Doug. For Dr. Hysmith, what's your message to the public? Because you probably have heard that people are saying, well, what's the point if I got vaccinated if I have to wear a mask again? What would be your message to those on the fence that are still persuadable?
No, I think that's a really good question. I think that for those individuals who have been vaccinated, we have seen Delta variant cause what's called breakthrough infection. So what that means is the vaccine is protecting that individual from a severe illness, an illness that would, land someone in the hospital or in the intensive care unit. The current vaccines don't protect as well as we wish against mild illness, such as a runny nose, cough, those sorts of things. I think it's important for those individuals who say, I'm vaccinated, I may not want to wear a mask in certain settings, to realize that not everyone around them have had the opportunity to be vaccinated, and that there's a possibility if they were infected with the Delta variant that they could transmit to an individual who hasn't had that opportunity. And I will say the large group that I'm the most concerned about is our pediatric population, that is 12 and under, that haven't had the opportunity yet to be vaccinated. So I think it's going to be a decision of knowing that there's a possibility that I could get a mild illness from the Delta variant, and that wearing a mask would prevent that. And if I do get a mild illness from the Delta variant, that the mask would help me prevent me from transmitting that to other individuals, such as those who haven't had the opportunity to be vaccinated.
Kelly Roberts, WMC.
Hey there. Kind of on the same topic of breakthrough cases, how concerned should we be the fully vaccinated when it comes to getting this virus? It does seem there seems to be a few more fully vaccinated cases reported in hospitals, and others just continually reporting these breakthrough cases. With an extra transmissible virus like we're dealing with right now, should the focus still be on obviously the unvaccinated, but how much should we be focusing, for example, on these breakthrough cases and the likelihood of them?
No, that's a good question. I think that if you guys will remember early on in the pandemic, there was a lot of data that we were getting on a weekly to monthly basis that was changing the way we were thinking about things early on. And I think that's sort of where we are right now with the Delta variant. What we do know about the Delta variant is, as you've already said, it's more easily transmitted, so it's highly contagious. That does not mean that it's transmitted in a different way. So I've said that multiple times to individuals, that the mask is still protective. It's not some novel way of transmission. It's just more infectious. So I think that focusing on the breakthrough infections that are these sort of mild illnesses that are not requiring hospitalization is important. I don't think that's the most important point at this time. I think what we really need to be focusing on is vaccination, because we know that vaccination will prevent the severe illnesses and the illnesses that lead to ultimately to increased mortality or death. So I think that's the part. I think the more we learn about the Delta variant, the more we will understand what these breakthrough infections actually mean. How contagious is a vaccinated individual that has been vaccinated that has the Delta variant? We're not entirely sure about the answer to that at this point. I think we'll know a little bit more about that in the coming weeks to months. I think the big point right now is to know that these breakthrough infections happen, that they are usually mild, but I also think that's one good reason why to look at masking indoors once again, is because we don't know some of the really important aspects of transmissibility at this point with regards to the Delta variant. I think that answered your question.
Yeah, thank you so much. And my second question is dealing with the upcoming health directive in regards to back to school. After the CDC changed its recommendations for masking indoors kind of to a universal masking recommendation, I talked to some Shelby County superintendents who have districts where masks are optional at this point. They said they're kind of following the Shelby County Health Department's lead to see what they'll come out with. Are you hoping a recommendation will change protocols in some of these schools, that it would go from optional to required, or would more of a mandate help require masks in schools if the department would like to see more masks in schools? Thank you.
So with respect to the schools are in control of their own campuses, and we've been repeatedly advised of the school's ability to control those campuses and to file and administer their COVID response plans. And so as part of the COVID response plan that they file with the state, they will include their decision about whether or not they will require masks on campus. So the landscape puts the responsibility in different places given the context. I'll also use this as an opportunity to respond to one other related matter, and that's the issue of mandated vaccines. And so local governments are not in a position legally, as of the end of the last legislative session, to mandate the COVID vaccine. So I believe we still have some ability with respect to other vaccinations, but vaccinations that are COVID related cannot be mandated by local governments at any level. And again, the decision among schools is that they have autonomy. I talked to a school superintendent this morning around the same topic, and each of those schools will be making a decision for their campus that they think appropriate.
Mandy Rock, Fox 13.
Hey, good afternoon, everyone. My first question is vaccine related. Some recent data from Pfizer suggested that a third booster shot of the vaccine would strongly protect against the new variant. So I just wanted to see what your thoughts were on that, and if someone does want a third dose as a booster, when might that be available to them?
Yeah, I'll speak to that just a little. So I think that we have seen this claim from Pfizer very recently, and then a few weeks ago as well, stating that they felt that a third dose may be beneficial. We've also seen several scientific publications over the last month or so that have suggested that we do not necessarily need a booster. And I think the CDC and the FDA have both weighed in appropriately and said at this time they don't feel like there's enough data to recommend a booster dose in a fully healthy individual. I do think that what Pfizer is thinking, well, it's hard for me to say what Pfizer is thinking. I do think that there's a possibility in the future that there will be a booster dose that could target some of the variants that we're seeing. And I think that might be beneficial, but as of right now, there's no recommendation for a booster dose based on the literature that's out there and the CDC and the FDA, and I agree with that stance. I will say that some individuals, such as those who are immunocompromised, those who take chronic steroids, for example, those who may be undergoing treatment for certain medical conditions, should discuss with their doctor regarding a third dose of the vaccine. We have seen that in those individuals, the antibody response is not as high as it would be in someone without those medical conditions. So that's one setting where I think that a third dose may be beneficial, but those individuals should chat with their primary care physician.
All right, thank you so much. And my second question is about the Lambda variant. Last week, it was said that there was one confirmed case here in Shelby County. So I was just wondering if there is an update on that and if we know where that case came from.
Thank you for that question. I am afraid I don't have the answer to that, but I will take that note and try to get back to you on that separately, because I just frankly did not ask for that update. But you're right, that is one, we said last week that there was one. So happy to get that information and get back to you.
Hannah Grabenstein, MLK 50.
Good afternoon. This is a question for Doug. You mentioned that the concierge vaccination service will have vaccines to people. I know you were using it, the term sort of just as a descriptive. I think it's a good term. And you were saying that you would have vaccines to people within 2 hours if they request.
Sure.
And I was just wondering, but you also said that if it's not there on the spot. And so I was wondering, will there be vaccines on the spot for some people? Like, is there a door-to-door vaccination campaign too?
Yeah, so that is the door-to-door vaccine. It's a really good question, but if you just think about the logistics of it. So our street team, we have dozens of people out in neighborhoods knocking on doors at one time. I only have 2 of the mobile vaccine units that I can actually deploy at any one time. I will try to put both of them on the street, but the likelihood is that one may be doing homeless, homebound vaccines, because that work still continues. We may be supporting a pop-up. But even more practically, when we fan out to do work and knocking on doors in a neighborhood, we're covering a pretty large area. So the machine cannot be with every single member of the door-to-door team that is knocking on doors. So it may be a few minutes to an hour or more before the machine can get back over to where that individual is. So it's just a practical matter of trying to reach as many people as we possibly can. And then when we ask them if they would like a vaccine, or importantly, if someone has changed their mind about a vaccine, we would like to get it to them as quickly as we can. So it's really a practical matter. I hope that answers the question.
Yes, that does. Thank you very much. And my next question, I have a couple of questions about hospitalizations. Dr. Hysmith mentioned pediatric cases rising in other southern states. Have we seen pediatric cases rise here substantially? And also, I'm wondering if we have demographic data on both pediatric and adult hospitalizations, specifically age, race, ethnicity, sex, things like that.
Right, I can answer a few of those questions. So we have seen, there have been reports from Mississippi and Arkansas that have shown an increase in their pediatric patients that have been admitted to their hospitals there. And I can say we have seen an increase in the number of patients that we have admitted here in Memphis at Le Bonheur. As far as demographic information for the adult population, I can say that we are seeing a younger group of individuals that are being admitted. I think that we all know from the history of the vaccine rollout, we targeted the first-line workers initially and then moved from the sort of elderly population down. And what we saw is as we would vaccinate one group, we would see the virus sort of move into the unvaccinated individuals that were lower down, and we've seen sort of a march down as we've been able to increase our vaccinations across the age ranges. So unfortunately, what we see now is we have approved the vaccine for 12 years and over. However, that 12 to 18 range, we still haven't had as much time as we've had with the other age ranges. So we've seen the virus move into that younger population a little bit more. And now that we have the Delta variant coming in on top of that setting, we're seeing those numbers increase as well. So I'll say that as far as demographics, age goes, that we are seeing it in a younger population, and we have seen an increase in our pediatric patients here in Memphis.
Abigail Warren, Daily Memphian. Abigail, I believe you're self-muted.
Can you hear me now?
Yes.
Okay, I kind of wanted to see, there's still a lot of confusion about when to mask and when not to mask. I believe Mayor Harris said maybe a month ago that, when you go to Target, you may not wear a mask. Would you encourage people when they go to Target to wear a mask? I think there's still a lot of confusion in the community about when to wear a mask or not.
Well, I can try, but the next health directive will fully flesh out a lot of these issues. The short of it is if you are in a high-risk indoor setting, we're urging individuals to wear a mask. Those high-risk indoor settings generally amount to areas where there is access to the public and the vaccination status is unknown. And the other big kind of bucket are individuals that know they will have to interact with someone who has a compromised immune system or other underlying condition that would make them more susceptible if they were to contract the virus. So those are the two big buckets, and that's what will be put in the next health directive.
Okay, thank you. And then do you also know at this time what percentage of cases are breakthrough cases?
I don't know, no.
I will get you the specific percentage, but it's fair to say that it is the vast majority of cases are new cases in unvaccinated people. The minority are breakthrough cases. So the total number of active cases, we have a small number as a percentage are, but I don't have the exact number of that, are the breakthroughs. The majority are in unvaccinated people. But I have that question as well. Apologize for not being precise on the answer. We are pinch hitting for Dr. Randolph, who probably had the information on top of his head, but we'll make sure that we have that precise answer for you.
We are out of time today. Are there any closing messages?
Well, I think you heard a lot today, and I want to thank Dr. Hysmith for providing that data. Thank you to Mayor Harris for being here as well today. There are some breakthrough cases, but the majority are on unvaccinated people. Vaccinations are our key to getting out of this in the long term. There is a lot of vaccination still available to you, a lot of testing still available to you, and so we appreciate the very vast majority of people here who are all with us and trying to do the right thing. And if there are any updates between now and next week, we'll be sure to put those out. And otherwise, you'll look forward to seeing us here next week with another update.
Thanks, everyone. Have a great weekend.